Welcome to the Healing Grove podcast. I'm Dr. Kristen Ryman, an integrative holistic family physician, author of Life After Lyme, and host in this virtual space of learning, healing, and growing. I believe humans are like trees, and our physical limb is only one of many. Health on all limbs of the tree, emotional, conceptual, social, spiritual, is absolutely required for the whole tree that is you to be vibrantly well. I created the Healing Grove podcast as a place to showcase some of the world's best integrative and holistic medicine, to expose you to transformative tools and mindset shifts for all limbs of your tree. I hope you enjoy our conversation in the Healing Grove today as much as I enjoyed having it. Hey everybody, welcome back to the Healing Grove podcast. I'm Dr. Kristen Ryman, your host in the Healing Grove, and I am delighted today to introduce you to my new friend, Dr. Summa DelSignore, but her pediatric patients often call her Dr. Summa. So I'm so glad you're here because we're moving into tick season in the Western Hemisphere, and there's a lot of your patients, my patients, who struggle with Lyme disease and other infections, and I can't wait to sort of hear what you're doing for them, how you're helping them, and get into your R.E.S.E.T protocol. But before we do that, I'm just going to share a little bit about you, Dr. Summa. So Dr. Summa is a board-certified child and adolescent provider. She's internationally known for her expertise in the diagnosis and management of complex chronic illness in children, which is unique. Not many providers specialize and focus in kids, and it's wonderful that you're doing that. She developed her own R.E.S.E.T protocol using a root cause lens to treat autoimmune disease, neuroimmune disease, and congenital immune dysfunction in a systematic and successful way. She's a fellow of MAPS, which is the Medical Academy of Pediatric Specialties. Is that right?
Special needs, yes.
Special needs. The AAOT, which is the American Academy of Ozone Therapy, and a member of ILADS and A4M, which you guys have heard me talk about before. And her expertise lies within these autoimmune, neuroimmune, psychiatric manifestations of infectious diseases, in particular tick-borne infections like Lyme and co-infections. In particular, also, because these things manifest neurologically, a lot of kids who end up with diagnoses like autism or spectrum disorders, PANS or PANDAS, and autoimmune encephalopathies actually have as a root cause or part of their root cause these infections. So I really am hoping that we can shine a light on that today with your expertise, Dr. Summa. So a little more background, she received her graduate and doctorate education from the University of Pennsylvania and SUNY Upstate Medical University, graduating Magna and Summa cum laude, and completed her residencies at some of the top children's hospitals in the country, including CHOP, the Children's Hospital of Philadelphia near me, Penn State Children's, and Children's Health in Dallas, Texas. She's currently the CEO and founder of Hudson Valley Integrative Health in Beacon, New York. What a cool name for the city that you started this practice in. You're a beacon of hope.
It's a great twist there, Kristen. I love
it. Who knew? So let's get into it by just hearing what brought you to the place you are now. Like, how did you get on this path of treating the most complex and immunologically challenged kids?
It wasn't a linear one. And you're familiar with CHOP, I'm sure, just in the neighborhood, right? And there was nothing integrative at all. They're wonderful for acute in so many ways. And so my mindset way back in the day was not integrative at all. I wasn't connecting the dots. I was traditional in that sense. And what kind of led me here was a couple of moves just with family and things like that kind of landed me in New York. And at the time, more of a life change, having a child of my own at that time. And I transitioned into more of an integrated pediatric outpatient type of a setting. And very new to me. I was skeptical, but thought, let me give it a try, and opened my eyes to a few things. I started seeing kids in a primary care frame, and there were kids who were coming into me that were chronically ill, and they didn't fit the bill. They didn't fit the pattern. They didn't fit in the box of whatever their diagnosis may be. And I thought, well, they're frequent flyers. They continue to come in every few weeks with a different ailment. They're not better. And it bothered me that I wasn't, able to really ultimately help them heal fully. And so that led to me just being very inquisitive, being that humble scientist and asking questions why. And it led me down a path with chronic illness and infection, things like Lyme disease. And speaking to the provider who owned the practice at the time who I was with, he says, we're in kind of like the capital of Lyme disease. We're at ground zero here in this area, the Hudson Valley. And I was like, okay, I don't know what Lyme is. I had no idea. It was never something that you're really educated upon in great length through any of, formal education, any school at all. And I thought, well, okay, all right. And so I started treating these kids, typically, based on CDC guidelines, and still we're not getting better. And so then I started to continue to seek out others and connected with Dr. Horowitz. And at the time, he says, I'm excited. You're one of the only pediatric people kind of doing it in this area who's interested in it and treating. And you're going to be that premier person. So I trained with him, gleaned ridiculous amounts of information from him, and moved along to also then train with Dr. Ken Bach to kind of really create an integrative spin on things from that perspective. And that sort of put me on this path and this trajectory to treat, complex chronic illness in children, which was chronic Lyme, congenital Lyme, autism, PANDAS, all the things that didn't fit in the box. And that's sort of what led me there. So initially it was a healthy curiosity from that perspective. Interestingly, it was almost a saving grace to have that mindset in place. Two things happened to me. One, my daughter was exposed to a tick bite at camp one summer when she was about 7 years old, and it led to Bartonella, Lyme, and Babesia. And thankfully, I had the knowledge base at that time to start treating her. Despite having that knowledge, it still ended up into this, it landed into more of a chronic kind of illness path for her for a period of time, and despite treating, and then for me, I think that there was a time shortly thereafter that I suffered a vaccine injury from the flu shot, almost killed me. Led to POTS dysautonomia very severely. I thought I was having a heart attack. I was in the cardiac unit for several days trying to figure it. Just thyroid failed, the whole thing. And so I was already practicing that, but I think after those two things happened, the issue, the tick bite with my daughter, and understanding how tenacious that bug could be, and then also my own struggle from more of an autoimmune perspective, from toxins and inflammation triggered from that vaccine, and probably having something else underlying that also contributed, really kind of solidified that path for me of healing, to say it really has to be this all-in comprehensive view of health, and with a health focus, not just disease, quelling disease or resolving symptom, but really focused on that health and wellness trajectory. So it was sort of this roundabout way that got me there. And then personal experiences, which really kind of solidified it for me.
Yeah. So it's like you were already on the path, but the universe was like, come on, stay on the path.
Let me
Stay on the
nudge
path.
you. Yeah, let
Yeah,
me
yeah,
make
roll,
sure.
roll nudge.
Yeah.
So I just have to ask, because I know so many of us on this journey of caring for people with these illnesses have had our own experience. And often it's the beginning of what put us on this path. It sounds like for you, it wasn't quite the beginning, but it was
Right.
instrumental. I'm curious to know if there are things you've learned since either your daughter's illness or your own illness, just because we're always learning and looking for the thing that's going to help that last patient who I haven't been able to get well yet, right? I'm
Mhm.
wondering if there's anything in retrospect you say, well, I would have done this differently now.
I think that in retrospect, I would have focused more on the foundational work. I think. Because like anybody, and this was 15 years ago or so, where it was sort of a little more knee-jerk. Now that I kind of look at myself in hindsight, to say rather than just starting with those symptoms and then treating and rounding out the comprehensive treatment with that, I would have gone back further quicker and said, okay, fine, we'll go ahead and start dealing with what's here in front of us, but let me very quickly take it back to the foundation and make sure that toxins are eliminated, the gut's in order, autonomic nervous system's happy, and really focus on those things, understanding how crucial they are. back then I knew, but I didn't really understand, that and understand how impactful those systems could be upon outcomes if they weren't healthy to start with in the beginning. So that's what I would do is just treat all of those things as a priority from that sense and make sure that we are really cleaning that system up and really, establishing a solid foundation.
Yeah.
Yeah.
Yeah, I think you and I had parallel journeys in that regard because I remember when I got Lyme, the Lyme that was the one that almost killed me, I
Yeah.
jumped on it with, all the things that I would have been trained to do as a Western doctor, Western medicine doctor,
Mhm.
and hadn't learned about the gut yet, hadn't like didn't really appreciate or understand the terrain and the importance of detox and drainage and all the sort of naturopathic things that I think those guys train in and get as part of their foundation. That wasn't my foundation as a medical doctor. So
Mhm.
yeah, I agree. I would do a lot of that stuff differently. And in fact, when I just am thinking about it, when I wrote my own book about this, just to say, here's my map, here's the map out.
Mhm.
Um, People sometimes say, well, it's so weird. I'm looking for how to treat Lyme, and it seems like you don't get to it till chapter 9. And I'm like, yeah,
Right.
it's because a lot of people by the time they're at chapter 7 don't need chapter 9 anymore, right? You like rebuild your body from the ground up, and then your immune system just kind of does its job in many cases, right?
Absolutely. Agreed.
So I would love to hear your matrix, your blueprint, your reset protocol. Can you walk us through the main features of how you do it?
I can, yep. So the reset protocol, we created it as an integrative kind of root cause approach to kind of promoting healing and empowering individuals to take control of their health as well. And so the whole focus was, me leading it, but then ultimately giving the reins to that patient. Say, here, you need to do this is an ongoing thing. You should always be resetting, right? You should always be evaluating. And so essentially what it is an acronym that I created that is for removing toxin burdens, eliminating inflammation, essentially restoring gut integrity, eliminating hidden infections, and transforming overall health. And it's a way to kind of decode what may be going on in your body. And it focuses a lot upon to the cell danger response and some of those primitive, intelligent cellular defense mechanisms. And those cells are screaming at us saying something's wrong, and sometimes we're not paying attention to it. And so I utilize that protocol to sort of set up phased approaches within the practice as I'm evaluating to say we've got to go through each of these categories every time you're here, no matter why you may be presenting to me, no matter what may be triggering that symptom. That's just the tip of the iceberg. That was the white flag. That was the point where your immune system or your body says, I can't take this anymore. And so I talk about that tip of the iceberg to say we have to work back through that reset protocol and figure out all those other root causes, all those other triggers that have stacked up that have led to this illness, scenario that we're now dealing with this person. So that's the way I approach it. And so no matter if you're coming in with toxin, vaccine injury, if you have a child who has autism and you're not sure what may be triggering or autistic like symptoms, I wouldn't say autism in and of itself because those are more symptom, or tick-borne illness, whatever it may be, we go through that protocol to ensure that we're very systematically looking at those categories to identify all potentials and then bringing that person back online to a path of wellness and healing.
Beautiful. Well,
Mhm.
I would love to kind of walk through that a little bit more in a granular way and just kind of hear what your tools are for each of those pieces. Can we do that?
Sure. So essentially, I start off with a very robust interview with about the child and their history, and then I dig in pretty significantly with mom and dad, which they're usually surprised by that and say, "Look, you guys, you're part of this. The exposures are there. There may be something that you had that you may have passed along, or Perhaps you had autoimmune tendencies or other genetic SNPs that could contribute and influence the way that your child developed in utero from an immune perspective and from a neurological perspective. And we need to explore that. So initially, it's a lot of data gathering there to really identify it. When, symptoms will most often tell us what we need to know, and then we back it up with diagnostics. So then I typically will start with, after that history, then looking at obtaining diagnostic to support, to say we need to identify the landscape of your GI. Let's see what looks healthy there, what shouldn't be there. Is there inflammation in that inner wall lining? Is there a digestive issue? What does that look like? Understanding that the gut controls a lot of the immune function and direction, and then also from a neurological perspective plays a big role in those neurotransmitters, and then how those are communicating effectively. And so we'll start with that. And then I'll look at sort of toxin, and I kind of lump in toxin with a lot of different things to say we're looking at mycotoxins, heavy metals, VOCs, plastics, anything that shouldn't be there. Mold's a big one. And then also I'm looking for infection. And infection can be tick-borne related, vector-borne related. We'll broaden that a bit. So from things like ticks and flies, fleas, lice, whatever, and then also look at heavy-duty, viral panels as well to get a good sense of things that are there. And then try to look at some parasites if we can capture them, because we know they're not just kind of freely hanging out, but kind of get a sense of that. So then I have all of that data, and then from there process it through and decide, okay, what's good about this person? What can we leave be? And they're healthy and they're fine there. And then we'll start categorizing the data based on history and then based upon the diagnostics that we're able to obtain, and start working away at that, chipping away to say we've got, we need to remove these toxins. Okay. So toxin removal would depend upon what's there. Do we need to bind and detox with things like glutathione and alpha lipoic acid and NAC? Give some charcoal and bentonite clay, some chlorella, do some detox baths, do some molecular hydrogen. What do we need to do to remove whatever that specific is? I do mild chelation, meaning very low dose oral that can be over the counter, none of the crazy IV chelations, which you have to be very careful, especially with kids. But I do very low dose, and we do it for a longer period of time. Then looking at things like infections, eliminating infections and inflammation. You can't quite eliminate inflammation until you kind of get the infections and the toxins too out of the way. So then I'll look at that and determine, well, what infections do we have on board? Are we dealing with tick-borne infections? What does that look like? Treatment for that is more integrative in nature. So I look at things like biofilm busters, fibrin nest busters, herbals that we know are quite effective, things like Chinese skullcap and Japanese knotweed and hutanya and a couple of other, assortment of things. And then we'll use certain antibiotics as needed for certain things, especially if there's something very active going on that needs to be kind of beaten down a bit, while we're still working on that foundation, while we're still working with the herbals, the biofilm busters, the fibrin nest busters, all of those things to really help move it. Viruses, same thing. Certain medications, not many, but more heavy duty herbals from that perspective. And then once I kind of have that landscape down to say, okay, these are the things we're going to have to layer in, let's start working on the inflammation. Let's start to ensure that we're managing mast cells and histamines and cytokines and all of those things that can continue that cycle. Let's make sure we're giving you very directed treatment to address all of those, right? Rather than saying, here's a Zyrtec, we don't want to do that. We want to make sure we're touching on every component of that inflammatory cycle. Otherwise, we can't shut it down. We can't we can't correct it. So we'll focus there. And then further removal, elimination is making sure that the kidneys and lymphatics and liver are working well. And I'll use a lot of homeopathic drops and supplementation. Glutathione is a big one for me. People tolerate it. Molecular hydrogen is another one that I absolutely love that hits nitric oxide pathway, and so it depends on the person. So I kind of go through each system, and it's very, it is precision medicine at its best, really, because I have general framework, which is reset protocol. That's the general framework. And then that patient comes into me, and everyone is coming in at a different level. And it could just be a little tweaking, or it could be an overhaul. It depends on that person. But we systematically go through it, and then that protocol is framed out specifically for that person, depending upon what their needs may be. But it's just taking that systematic approach, saying foundationally, here's all the junk, this is all the stuff in the way. Let's make sure that we're tapping into that, and then let's work our way through the other systems that we know we need to have on board for this person to get healthy and to reach that level of wellness.
I mean, I have a million questions for you, but I just want to start by saying, like, we have a lot of the same tools and framework, I think. As I'm talking and hearing you talk, or as we're talking about this, I'm just thinking about the underlying assumption that I think both of us share is that autism is a label.
Mm-hmm.
It's a collection of symptoms.
Correct.
And those symptoms, if we can find the root cause of them and eliminate those causes, the symptoms disappear, and then therefore the label is no longer needed.
Right. Right.
Which is a
Absolutely.
long way of saying autism is preventable and treatable,
Yes.
which is, let's face it, a very controversial statement.
It is. It's actually revolutionary, right? It's kind of like we have the old guard and the old institution camps that say this is a static thing. You have autism. And you see in the scientific community where they're trying so hard to find a genetic link, a specific genetic link, and there isn't one. And it's just holding on to that camp of old institution. This is what it is, and we're comfortable here, and we can live with this. But those of us, you know, uh, saying otherwise, much like you and me, saying that there are other underlying contributors that we can actually change some of the trajectory of these kids. You're kind of like that scientific revolutionist, the ones who are pushing against that paradigm. So absolutely,
Yeah.
absolutely.
So
Yeah.
I know there are going to be people listening who are like, yeah, I don't buy it. Never seen it,
Oh,
can't
I'm sure.
imagine it. My doctor said. So I wonder, can you share a story, obviously with de-identified information, so no patients are exposed,
Sure.
but like, can you just tell us, give us an anecdote about someone who lost a diagnosis that you're not supposed to be able to lose?
Right. No, I have several. I have several. So one in particular that comes to mind was he came to me as a 3-year-old. Mom actually had active Lyme and Babesia at the time during her pregnancy, was being treated the entire time of the pregnancy. And when he was born, was very symptomatic. Wasn't tested for those tick-borne infections, but he had a little more prolonged jaundice. Okay, he's a little hypotonic. He's floppy. He's not a good feeder. He's sweating like he has menopause. I mean, no one's looking. So, and that went on for quite some time. And he was, round and round with pediatricians and other specialists saying, we don't know. And by the time he made his way to me, he already had the diagnosis of autism. Developmentally, he was delayed. He was nonverbal, severe sensory and texture issues. So he had a G tube to feed because of that. And hot mess, hot mess. So we worked through some diagnostics and determined that he also carried the same strain of Babesia as mom, as well as Borrelia burgdorferi, and started treating him. And I'm, certainly summarizing this. There's a lot of treatment involved. But he was my first kid that I worked up to a dapsone protocol, actually, at 4 years old. And he started talking spontaneously, just started speaking, started eating. And I mean, it was within about 4 months. It was that miraculous with him,
Wow.
where we were treating and treating infections and improving the groundwork. And he was getting better. He was, mom would say he's He's more attentive. He seems to be trying to make more words, or he'll say one or two words here. So he was very slowly gaining certain skills. Texture was starting to lighten up, but not there. But once we started the heavier kind of combos, and he wasn't just on Adaptone, he was on herbals, he was on biofilm busters, he was on fibronest busters, he was on gut support, heavy detox. So we were working up to this. Supporting his methylation pathways. We had the right amount of methyl B and folate, and started him on some low dose methylene blue, and everything was weight based. Everything, safety profiles were, top of mind the entire time. And by the time we added things like Dapsone on board, which we know is an anti-inflammatory, neurologically, can modulate the neuroinflammation, but also help us treat the tick-borne infections, the kids start speaking in full sentences, which isn't supposed to happen, right? And texture reduced to the point that we weren't using a G tube at all. He was eating a plate of French fries at Thanksgiving, and was one of the biggest moments ever. Mom still sends Christmas cards to me every year, and he hand writes a note to me every year. But I think that the biggest miraculous turnaround was within that 4 months of starting the medications, where he's speaking full sentences, and he's told everyone at the Thanksgiving table that he was thankful for the plate of yummy fries that he had, and he was eating French fries. It was incredible, incredible.
Amazing.
And
Amazing.
so, yeah, it does speak to it.
How do you understand? I mean, I have a couple working hypotheses about why these infections are so detrimental to neurology. But how do you explain the mechanism of action such that Babesia and Borrelia, Lyme cause such deficits?
Right.
Brain.
And well, in kids, it depends upon the exposure when. So I do see if it's more congenital in nature, and we know that that's something that's going on, it's going to, because that fetus, we don't think about it, but that fetus is evolving and responding in real time to every input from mom, whether it's an infection, inflammation, whatever. And so that immune system is finding an alternative pathway to function, and that neurological system is also finding a way, because those microglia are under attack. And you know as well as I do that in those early stages, its job is to help with pruning, synaptic pruning, and making sure that things are lined up and set up appropriately before it steps back and says, I'm just going to kind of help from an immune perspective later. But it's helping to actually mold and develop. That's under attack. So you get this alternative pathway of development, both from an immune perspective and a neurological perspective. So let's say they're not exposed, they're lucky enough to not be exposed in utero, and they're exposed as a young child. Again, that brain is still in a very active growth phase and very vulnerable and very sensitive. And you've got a blood-brain barrier that, yes, it is developed, yes, but it's more susceptible for certain infections to cause inflammatory markers to cause, to have impact. So I see that as being one component, and I see so not necessarily, well, it's actually both. It's the inflammation from the infection, and the infection itself can make its way across into this immune privileged area and trigger that microglial to react. And then that inflammatory response begets more inflammation, and there's really nowhere for it to go. And then it mucks up the system. You get all of this inflammation blocking, neuro synapses and neurotransmitter connection. And there you have the behavioral and the cognitive decline. So it's a real thing. It's a biomedical condition. And I don't know that we see it that way when you kind of put a label of autism or PANS on it, because like you said, those are collections of of symptoms. And but yeah, that's the very straightforward biomedical approach.
So in the interest of busting some more myths here, because I
Yeah.
think there's a lot of misunderstanding, sometimes from authority, a lot of the time from authorities who say that, autism can't be prevented or cured, or Lyme disease not congenitally transmissible. Okay, that's
Mhm.
clearly wrong. But
Right.
here's a question I have that's confusing about this case. So this mom was clearly seeing somebody who was Lyme aware,
Yes.
right? Because it's unusual to have your regular doctor say, screen you for Lyme to begin with in
Right.
pregnancy, and
Yeah.
then know how to treat you or even be willing to treat you.
Hmm.
And so I'm sort of surprised by this sort of this paradox that she was treated maybe appropriately, but certainly someone was making an effort to be comprehensive
Right,
and
right.
cover babesia as well. And yet the placenta wasn't sent, or, people didn't think to look in the baby. What do you
Hmm.
make of that?
I think that it was just having the data at the time, doing the best that they could do. And, being mindful of safety profiles of medications. And at the time, understanding that the mom had these infections before pregnancy and was being treated before pregnancy, thought she was in a good place, based upon that, and then tried to have, pregnant, she did, and then maintained treatment throughout. It was the medications, I feel, that the mindset at the time was that we're treating mom, not baby. We're treating mom to prevent transmission. And the mindset now should be, and the approach I take is, well, we need to treat mom and baby because we know Borrelia Bartonella uses a TEM pathway. Essentially, it allows them to burrow through between endothelial cells. Placenta, the last time I checked, has endothelial cells. You can burrow through. And Babesia rides on a red blood cell. It doesn't need anything. It just goes right through the cord blood. So you've got to make sure you're also treating that baby, right? And ensuring that you've got that sort of assault on those bugs on the other side of that placenta as well. And then you're not just looking at mom. And I think that that may have been, and that's a big misconception. Well, if I treat mom and her levels are low, we're probably fine. Well, it's not always the case. We know that there can be transmission from day one, that during that first trimester. And a lot of providers will hesitate and not treat during that first trimester of pregnancy. They're fearful. And the argument I will make is that, well, we know that there's a 30% chance of miscarriage by doing nothing. That's pretty high. And that doesn't stack on any other issue that may be going on. Maybe the health of mom, her uterus, genetics, inflammation. So just that bug alone puts you, those infections alone put you at a 30% risk of having a miscarriage. And so that has to be a very honest discussion with those moms about that. But I think that's usually the bigger issue is that providers are waiting until we're into that second trimester before really digging in with treatment. And we've got to really back it up and say, yes, there's a risk, but there's a risk of doing nothing too, a pretty big one. And we've got to just take it methodically and very carefully, but we have to do something to treat.
Yeah.
Yeah.
I'm wondering if you have the same clinical experience in terms of numbers and rates of reduced transmission as Charles Ray Jones. Dr. Charles Ray Jones was sort of the pioneer of pediatric Lyme disease. And
Mhm.
I think I remember reading him say, it's a 50% chance, you said 30%, so 50% chance of transmission with doing nothing, no treatment of mom, a 25% chance if you put her on one antibiotic, and a 1% chance on two antibiotics. That was his kind of rule of thumb. I wonder if what your numbers are and what that looks like.
I would say that the risk of transmission on a couple of antibiotics is much, much higher, honestly. I do feel that, again, understanding the nature of the bugs, understanding that the bioavailability of a lot of antibiotics that aren't going to cross. So just as an example for Babesia, um, the typical treatment is Malarone and azithromycin, right? So azithromycin will, like, I think maybe 3% of it will cross a placenta. It's not enough. So
Yeah.
you've got to look at some of those other drugs that kind of seem scary to you, but you look at like clindamycin and you look at quinine and things like that, and you kind of have to a degree if you've got some really active cases because we need to ensure that that med is crossing the placenta and also treating the baby. And again, it's case by case, absolutely. And I love Dr. Jones, and I appreciate all the work that that man did. He really put his neck out there back in the day. And yeah, absolutely. And I'm glad though that we've used his data and his teachings as sort of a springboard, and we have more information now to understand. We have 40 years of data that is finally coming out on case study after case study within OB, within pregnant cases, and the outcomes of that. To say yes, these things are being transmitted at all phase of pregnancy pretty significantly, and we need to and we're seeing that there are many of those cases that were treated with two antibiotics, and it still made its way through. I think that timing plays a huge role, honestly.
Yeah.
And I think that, continuing to push the congenital vector-borne illness narrative is what we need to be doing so that we can get some really great studies there versus collections of case studies and, educated guesses to some degree, exactly on where that threshold may be of
Mhm.
transmission. I think that's the bigger problem. So,
Yeah.
yeah.
So you're following, you see a lot of kids. You're also seeing kids in utero. I
Yep.
understand
Yeah.
you're taking care of women who are pregnant and have had Lyme and do have Lyme.
Mhm.
What are you doing to test the baby? What's your usual protocol after a birth?
Right. So we're testing mom, and then post baby. The unfortunate part is you can do a heel stick and you can test them for babesia pretty, straight, immediately. But looking at some of those other infections, they may not show up. And again, baby's still going to have mom's immune, markers for a period of time. So you're not really testing truly the baby. But we can certainly send cord blood, placenta samples to get an idea of what may be there. It's not 100%, it's not, causation, but it just gives us an idea of, okay, if it's there, there's a good chance that it's made its way over. And then, so babies, I will, depending upon the scenario, I will start to treat in some way. If we know that mom was active with infection, if we know that labs were coming back positive, if we know that placenta cord blood was showing evidence of it, and or if that child was showing a little, soft sign, right? It's not going to be EM rash and and joint pain, and they're not going to tell you that anyway. But if it's sort of like, okay, they're a little bit, more irritable than you would expect, and they're really bad feeders, and maybe they're a little more jaundiced than they need to be, and or their tone's not so good. It's the softer signs
Mhm.
that I'm looking to treat, for the as long as we need to, honestly. Testing that child, I'm waiting somewhere between 2 and 6 months of age before we can really see if there's something there. And the tricky part with kids is that if there was that exposure in utero, then their immune system's already learned how to live with it. So it's not necessarily going to be as responsive to it as if it were you and me. We're already cooked, we're getting exposed, and our body's saying, hey, something's wrong. When these bugs have figured out a way to live, coincide with that child who has this developing immune system, and it's going to be desensitized to that a little bit. So it takes more clinical observation than anything. And again, serial testing every so many months before you see any kind of an antibody response happen. So it's a challenge. It is a challenge.
Yeah.
It's taking all the data you can possibly glean from that and understanding the context of the situation and the scenario and making that decision to treat.
Yeah.
Yeah.
Yeah. Well, I'm so glad you're doing it. Do you find yourself sort of alone in the world?
Sometimes. Yeah. Yeah, absolutely. I'd rather not be, but it is what it is. It's it's the right thing to do. It's not
Yeah.
always the fun thing to do,
Yeah.
but it's necessary.
Yeah.
And I'm hoping that others will feel empowered by what I'm doing, what you're doing, to say, yeah, we need to get behind this and we really need to view this differently and how we're treating these patients.
Something you just said really hit me, which is, the baby can't tell us if they have joint pain or, they're not going to present in the same way. And then this idea that like the bug has, if you're picking it up in utero, your immune system is almost normalizing and it's not creating the proper response. And I think about all the kids who have, PANS or PANDAS or these infections that, you know, it's to me, it's hard to even a child who's older and maybe verbal may not verbalize things that they just see as normal,
Correct.
right?
Correct.
Their brain has always
Absolutely.
been working that way and they don't know it's not normal and healthy for their brain to be functioning that way or not functioning that way, as the case may be.
Exactly. And I find that when I ask kids a general question, How are you feeling? Oh, I'm good. Does your head hurt? Well, yeah, my head hurts all the time. Okay, but that's normalized for them. It's supposed to be that way. Or their joints hurt. Well, yeah, my knee hurts a lot, but I'm good. I'm good. I can play. I'm hanging out with my friends. It's normal for them. They've normalized it. So the assessments there can be challenging too.
Yeah.
So it's just having that, acute observation, asking the parents, what are you seeing? Having teachers report to let us know cognitively, what are they noticing? What are the kids' energy levels looking like at school? So you have to kind of pull data from all angles to really try to put it together. But yeah,
Yeah.
it's normalized for them.
It reminds me of when I did my first elimination diet in like 2014, and I inadvertently added back gluten before I was expecting to. I expected to add it back and didn't know what I'd find, but I didn't know I'd added it back. It was hidden in a bar as like rye flakes or something.
Uh-huh.
And I remember eating this bar and being like, wait, there was nothing in there that should cause this like gassy, bloaty, sharp pain. And all of a sudden I was like, wait, I haven't had that in 30 days. That's how I always used to think digestion felt.
Right,
Because
right.
it's normal. It was just what I'd always been living with, you know?
Exactly. Elimination diets are a wonderful example of that. Any of us have ever done it and you don't realize how awful you felt, until you pull those offenders away because your body was used to it and adapted to that level, right? Of normalcy or that level of function.
Yeah,
Like,
totally.
mhm.
So, is there anything we haven't talked about that we should talk about?
Oh goodness. Well, where do you want to go? Where do we want to go with this?
So, I always try to get in the head of my listeners and ask the questions they would ask. And I think I feel like there are two big categories of people who love an autistic child. There's a
Mhm.
category of people who, well, they all love their child and want the best for your
Of
child,
course.
right?
Yeah.
There's a category of people who are like, I'm gonna find a doctor, a practitioner, a chiropractor. I don't care who it is. I want someone to help me heal my kid because I believe I can heal my kid.
Hmm.
And then there's the group of people who are like, don't talk about healing autism. It's just a neurological difference. It's just a sort of like neurodiversity. We don't want to like get rid of neurodiversity, do we? And I feel like maybe those people are often the people whose kids aren't eating poop
Right.
or
Right.
hurting themselves all the time. Like there's such a spectrum, and
Right.
it's hard to talk about sometimes because you don't want to take away people's, sense of pride and what they go marching for if that's really working for everybody. But on the other hand, there are a lot of people for whom this diagnosis is quite painful and painful to the family, painful to the child. I mean, excruciating to everyone involved. So how
Mhm.
do you, I mean, maybe you don't even have people who come to you who aren't in the camp of like, I want to do everything, but how do you wrangle with that?
Without, allowing that family, how would I frame this? So I think that, when parents have a child with autism, and I can only make the assumption because I don't, but I see it, it's almost like there's an identity that's been, developed around that. Like this is our child, this is our life, this is how we do, right? This is what our plight is, right? And it's not a negative one per se, it's just an alternative one. And it's very difficult to let go of that identity, even if there's something that could be beneficial in a way. And I do see that. And I had that when I started treating kids on the spectrum. I was taken aback by that too, of the don't try to tell me my kid's not autistic. When my thought was, well, what if it was just a label that was given, perhaps not appropriate, but biomedically, we could improve them. We could improve upon their communication. We could improve upon the way they perceive their world and the way they process, and ultimately, allow them to reach a better level of wellness. If they're happy, that's great. They're happy. It's not about happiness. It's just about function more so. And I would just break it down more in that more biomedical science view to say, we need to optimize the best that we can. And rather than just holding tight to that static label of autism, just ask the why questions. Well, why? And what if? And ask the what ifs. What if we could, improve their gut health and then they could eat healthier and be a healthier, thriving adult later, right? Or what if we could remove that inflammation from their brain and help them make better connections there, and processing is better, and maybe they're less rigid, and maybe life is more joyful for them because they can process better. And so it just depends upon where those parents are. I mean, but you do have to tread lightly with it. It's not that I'm trying to break down your identity at all. It's more of I just want to help improve. And I think we can all improve, whether we're on the spectrum or not. I'm always looking to improve anything, right? With our lives. Like you spoke about the bougie bacon that you had to, that's why you have to work, right? To keep you stocked with that. We're the same way, but I've got certain my things, right? My idiosyncrasies, my things that I like to do from a health perspective, just to, you know, feel good as I'm aging, and we don't quite bounce back as quickly as we used to. You just want to be healthy.
Yeah.
So, I don't know if there's an answer really, but it's just trying to understand the mindset and hopefully in a way to convince them without them losing that sense of
Yeah.
identity.
It's tricky because I think that identity that you talk about is crafted through suffering and through pain and as a survival tool,
Right.
and as a way to get some validation from the world and maybe some resources that can really support, fill some gaps for you. And so,
Mhm.
I guess I wonder if there's a middle ground where like we're going to work together to, as you said, bring your child to a higher level of health and wellness.
Mhm.
And at the end of the day, you can leave the sticker on your car if you want it there.
Absolutely. It's a cool puzzle piece. I love the logo. Yeah, it's great. Okay. But no, you're right. It's more of a let's explore. Let's just explore and see. And if we still have that label or that, so be it. But what if there was something there holding back that didn't need to, right? And if we can at least work through biomedically and get root cause. And yes, if there is something that happened and it was a combination of environmental exposure in utero and just an alignment of certain types of genetic SNPs, and that led to this, then that's fine too. But if there is something that a child is carrying that shouldn't be, maybe let's work through it. And then maybe that's the middle ground, just to say we're not going to remove it, we're not removing the label, but let's work through biomedically and see what we can do to lift certain symptoms. So
Yeah, I
yeah.
love that. So I have one more question, and it comes from the comment you made earlier, which when you were talking about different toxins, you said mold is a big one. I
Mhm.
agree. Mold is a huge one. And I wonder if you have sort of an intuitive sense about this, because I often think about this. If mold were not a thing, how many of your people would be able to recover with doing nothing else because the mold is no longer in their body, then it's not undermining their immune system, clogging up their detox, damaging their DNA, all the things mold does. How big of a role is mold, and how many people would be able to go back to, business as usual if that weren't a feature anymore for them?
Right. I mean, I would think that within my population, a good 60% carry it. And if we didn't have that, I think that we would certainly be able to get them to the finish line very quickly. But it's a problem. It's in our food sources. It is in, our environment around us. And I think that we have other toxins too that contribute to that, our inability to filter it out. Because again, mold's natural, it's organic. We're all going to have exposure, but it really depends upon how well your body's fortified and how great your detox pathways are to be able to expunge that out. And I think that there's so many other components that kind of stack with it. Again, like I said, our food sources are dirtier than they've ever been. And the environmental exposures that we have, just the particulate matter in the air that we breathe, you can't really get away from that, right? And our water sources and what's in our soil, unless you're being really careful, we're going to have that added exposure that, our parents, our grandparents didn't have. And so we have these kids coming into that world at baseline. And then on top of that, then they get this mold exposure through things like grains and peanut butters and like things that kids like to eat, like those foods, chocolates, and for us, coffee and tea, things that we need a reason to live for, like those yummy those things, right? And so it's in common food. And so then we're giving this to our kids, and there's just this extra burden upon there. So I do find it's a big hurdle to overcome many times for the sake of wellness and health. And if we're, again, just focused on the infection or the imbalance and we're not focused on the toxin world, then we're going to miss a lot of it. And we're going to kind of stay on this sort of hamster wheel, right? Where we're having moments where we're healthy and then we're just right back in there again.
Yeah, no, it's such a good message. And for those listening who, as again, I'm always listening from the perspective of my patients and my community. I know some of you out there heard that litany of things that we're all up against and you freaked out a little bit.
Right.
A little bit. I want to remind you that, you have a pulse, probably
Yeah.
still here. There's still time. There's still stuff you can learn. Stay regulated, people. Do your tapping, do your mantras, do your chanting, do your whatever it is you do to get regulated, because it does take a lot of effort to when you're up against these sorts of things, and when you're either genetically predisposed or just preloaded with a lot of toxins, and as a result kind of at a disadvantage from the get-go, like it's still possible to heal. You and I see it all the time
Absolutely. Absolutely. The
in
body.
some of the sickest people, in some of the sickest, most toxic people, we see people heal. So
Absolutely.
I want to make sure people have that, leave with some hope. So the other thing I want them to leave with is a call to action to go to your Instagram. You have an awesome Instagram
Thank you.
called NY Limes and Pans. We'll put a link to it in the
Okay.
chat or in the whatchamacallit, the Doomafletchy,
Yep.
the little notes. And what can people expect to find there? I mean, I know what I found there, but what do you hoping people get out of that?
Right. So the whole idea for the Instagram page and even the website is to empower you with education. So I talk about a lot of different things, higher level, information about certain syndromes and certain types of conditions down to certain types of treatments and really just spelling it out so that you're empowered as a patient, you're empowered as a parent of a patient to know that next step and to have that knowledge to know where to seek out those providers or treatment or what have you. So that's the main goal, is to really educate those out there so that you can
Amazing.
hold those providers accountable, right? All those other providers too.
That's right.
Yep.
Everyone learns together. We're all learning together.
Absolutely.
So we'll put a link to that. We'll put a link to your website. So if people want to work with you, are you still taking new patients?
I am, absolutely. Yep. I primarily see children and I work with pregnant moms or moms to, who are family planning along with their OB to make sure that they're in the best state that they possibly can be.
Amazing. And telemed is a thing too. You can see people in other states. Awesome.
I do. Absolutely. All
So
over.
we'll link to all of that so that people who love you after this interview, which is everyone who heard it, I'm sure, will be able to find you if they need you.
Right.
And thank you so much for doing this.
Of course. Thank you, Kristen. Thank you as well. You're doing the same. We're in this together.
Yeah, we're in this together. It's
Yep.
nice to have a fellow person in this together who's not too far from me.
I know. I didn't realize you were that close. Yeah, absolutely.
Well, this has been great. Appreciate you so much. Thanks for everything.
Thank you, Kristen.
I hope you enjoyed this episode of the Healing Grove podcast. If you liked it, please be sure to like and subscribe. And if you want to deepen your experience further, consider grabbing a copy of the Healing Grove Playbook. With journal prompts for this podcast and 41 others, it's the perfect place to record your learnings, keep track of the tools you explore, and reflect on your own experience. Finally, it's important to mention that even though I am a doctor, nothing you hear on this podcast, whether from myself or my guests, constitutes medical advice. Any intervention you try should always be discussed with and supervised by a trusted member of your own healing team. Thanks for listening, and see you next time in the Healing Grove.